If you have a scoliosis or one of your loved ones has been diagnosed with a sideways curve in their spine, they may have a scoliosis, chiropractic may be of great benefit to you. So we're going to show you today how Arizona Chiropractic Center will help you with that condition. So the first thing we need to do is call our amazing front desk, create an appointment, and we'll start this ball rolling. Now, examination will happen after we do a detailed history and consultation. So we need to find out, do you have this problem? So in your back, you may know this, you may not know this, but your pelvis should be level. When we look at you from the side, it should be even. Your spine should be straight. When we look at you from the side, this is the same angle that I'm standing. You should have a curve in the low back, a curve in the mid back, and a curve in the neck. One of the problems that happens is sometimes the pelvis misaligns. Sometimes the leg is longer than another leg, and that could send the spine off into a really bad curve, and that's the scoliosis. We need to find out what is the contributing factor for your scoliosis. Another examination that we do is this little test right here. This is a machine that we can sometimes run down the spine, depends on what we suspect, and this will tell us whether there are hot spots, inflammation inside the back that can be contributing to the misalignments that's causing your scoliosis. If we suspect that you have such a curve, we can take digital x-rays and find out without any guesswork. After the history, the consultation, the examination, we will also do a neurological and orthopedic examination. Now, assuming that that is the end of day one, we're going to schedule for day two, and we're going to give you our best recommendations on how we're going to address your problem. So let's talk about day two. So we have a way of adjusting the spine. If the joints have misaligned in the spine, we can adjust them back into the right position. But again, we'll find that out after looking at x-rays. Did the pelvis twist? Did it tilt? And this is an example of the scoliosis in someone's back here. Very twisted low back. The side of the back is also very twisted as well. So it's got some issues. But that person has benefited greatly from chiropractic care over the years. We can also use cold laser. There are lasers that heal, that speed the healing, and that's one of these lasers right here that is going to reduce pain, it's going to reduce inflammation and help restore normal function as quickly as possible. Another laser that we may find useful for you, and it really depends on what we find with you, is going to be the FX 405. That is this laser in here. It's the best laser in the world. I have a bit of a passion for lasers. I've been using lasers in this office for about 15 years, and this is the best laser you can get, the FX 405. All the diodes rotate. There's a violet, there's a red laser coming off of the sides here, and it's a very good therapy. Another therapy that we may use, we may not use, depends on what we find with you, is shockwave therapy. Shockwave therapy is not a shock at all, but it's a sound wave that goes into those really tight muscles, and it takes those tight spots and frees them up. So if you've got a scoliosis, you know what that feels like, and that's exactly what you want to happen. So that's a great therapy. And the last therapy that we're going to show you today, should we use it, is called pulsed electromagnetic field therapy, or PEMF. Our office has 3 of these units, and it raises the electrical charge of cell walls. It feels like a massage for your nerve system. It's very calming. It's very relaxing. It feels great and can take a lot of stress off those muscles. So depending on what we find with you, we will piece together a plan for exactly what we believe is going to give you the best relief from your scoliosis. We look forward to seeing you soon.